Hello, everyone. Thank you for joining us today. Today's webinar is about waterpipe smoking, the pressing need for risk communication through health warning labels by Dr. Taghrid Asfar. So as you can see, everyone is muted by default. And in order to ask your questions during the question and discussion time, we please ask you to use your raise your hand button on your right so we can unmute you so that you can ask your questions verbally and directly to Dr. Asfar, or you can submit your questions and comments using the question panel on your right. And we can read it out loud for the rest of the teams to hear and Dr. Asfar to answer the question. So today's session is waterpipe smoking, the pressing need for risk communication through health warning labels. The objective of today's webinar is the potential of health warning labels for waterpipe regulation, the development of the first set of health warning labels for waterpipe using international Delphi study among experts. And our speaker for today is Dr. Taghrid Asfar. To tell you about Dr. Taghrid is an assistant professor of epidemiology in the Department of Public Health Sciences at the University of Miami, Miller School of Medicine, and a full-time member at the Sylvester Comprehensive Cancer Center. She is also a member of the founding team of the Syrian Center for Tobacco Studies, a pioneer research and capacity building institution in the Middle East. Dr. Asfar has extensive experience in tobacco research control research nationally and internationally, including epidemiological studies of tobacco use, randomized control trials of behavioral smoking cessation interventions, and tobacco policies and regulations. She has published numerous scientific reports in prestigious journals, example Cochrane Review, Tobacco Control and Addiction, currently at the Department of Public Health Sciences at the University of Miami, and as part of her efforts on an NCI grant, Dr. Asfar is testing a novel worksite smoking cessation intervention for Hispanic construction workers in South Florida. She is also serving as a co-investigator on a smoking cessation project funded by Florida Department of Health, James and Esther King aims at addressing racial and ethnic tobacco health disparities via group intervention. Dr. Asfar is a co-PI on a recently awarded NIH grant entitled Translating Evidence and Building Capacity to Support Waterpipe Control in the Eastern Mediterranean. As part of this project, Dr. Asfar is leading the development and testing of waterpipe-specific health warning labels targeting young adults in the Middle East, specifically in Tunisia and Lebanon. So, Dr. Asfar, thank you for joining today. Hello, Dr. Asfar.
Yes. Well, thank you, Nadia. Thank you very much for the introduction. And thank you for inviting me to participate in this effort. And I want to say hello to everyone joining us today in this webinar. And I hope you will enjoy the following hour with us. So do you see, Nadia, do you see my screen now?
Yes, we can see your screen.
Okay, perfect. So I'm talking today about waterpipe smoking, the pressing need for risk communication through health warning labels.
Okay, Dr. Asfar, can you please use the slideshow mode, please?
Okay. So, do you see it now?
We see it with the notes as well.
I have two screens.
Okay.
Try how to
So you can just, maybe, yeah.
Because I have two monitors, so let me do the opposite. Okay, so now. Oh, still?
Yeah. Okay, just click on these three buttons here.
What should I do? Sorry, Nadia?
No, it's okay. Just open, please, the presentation.
Yeah.
Okay. 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 Okay, but it's okay, fine.
Let me do this.
Yeah. Okay.
No, it's not working. I'm trying again, but it's not.
Yeah, click here at hide presenter view. Hide presenter view. No, above screen.
No, it's opening, but the full screen it's appearing on the other screen. So, and I don't know how to move it to this screen.
Okay, just walk through the slides. It's okay, like just like that. It's okay.
Okay. So this work is part of our new project, translating evidence and building capacity to support water pipe control in the Eastern Mediterranean. And it's a 5-year project, RO1 grants, funded by the National Health Institute and Fogarty International Center. And I would like to acknowledge my collaborators on this grant. We have 5 universities from the US and 2 universities from the Middle East. From the Middle East, we have Dr. Rima Nakash from Lebanon, from the American University of Beirut, and we have Dr. Habiba bin Ramadan from Faculty of Medicine of Tunis, from Tunisia. And from the US, we have Dr. Wasim Maziat. He's our PI on this grant, and he's from Florida International University. And we have Dr. Ward and Dr. Schmidt from University of Memphis. We have Dr. Eisenberg from Virginia Commonwealth University, and we have Dr. Trasher from University of South Carolina. And I would like to mention that this project represents the continuation of more than 15 years of collaboration for members from the Syrian Center for Tobacco Studies. This is how we look on the map. So basically we have, as I mentioned, 5 universities in the US and 2 in the Middle East. The main objectives or aims for this project are to understand the nicotine dependence trajectories among a cohort of young water pipe and cigarette smokers in Lebanon. This study is a school-based longitudinal study, and it has been going for the last 5 years, and it will continue for the next 3 years to see like change in dependence, progression, or smoking cessation, or starting another tobacco use methods. The second aim is to develop and test water pipe specific health warning labels for the Eastern Mediterranean region using a mixed method approach, and this will be the main topic for my presentation today. The third aim is to conduct situational analysis of local tobacco control, just to investigate and explore the policy environment in Tunisia and Lebanon for implementing the health warning label regulation in these 2 countries. And we have also a training component for researchers in the 2 countries in research methods. My main objectives for today's presentation are: first, I would like to discuss the potential of health warning label, applying health warning labels for water pipe regulations, and also challenges for developing health warning label for water pipe. And I will present our work as part of this project in developing the first set of the health warning label, and how we are adapting these labels now using focus group among the target population. And I will also introduce 2 other small studies, 1 experimental and 1 lab study, for further testing for the health warning label. So the need to communicate the risk of water pipe with smoker, I think we are all agreeing on this, and that's why we are here in this webinar today. As you know, now water pipe smoking has become the #1 tobacco use methods among youth in the Middle Eastern, in most of the Middle Eastern countries. The main reason for this rise in water pipe smoking is the widespread misperception of reduced harm compared to cigarettes, mainly because they think that when the smoke will pass the water, the water will filter it, which is wrong, as we have accumulated evidence shows that water pipe smoking can lead to dependence and many of the non-smoking related diseases. So this really indicates that we have a gap in communicating available evidence about the harmful and addictive nature of water pipe smoking with young people. So why health warning label? In specific, health warning label has potential to communicate the risk of water pipe with a smoker because it's part of the FCTC. It's Article 11. And also health warning label can serve as portable sources of health information for smokers and non-smokers as they will be displayed each time the product is used. So it will be good exposure for everyone. And health warning label on cigarette proves to be very effective in correcting the harm perception about the tobacco use, and also encouraging smoking cessation and discouraging initiation among young people. Challenges for developing health warning label for water pipe. Water pipe is different than cigarette. It's a multi-component tobacco use methods. There are many elements that are involved in this tobacco use methods. We have the tobacco package, we have the device, we have the accessories, and we have the charcoal as well. And also the setting is different for water pipe use than cigarettes. So the setting, for example, usually health warning labels are applied on the tobacco package, but this will not be effective for water pipe because for most smokers who practice the habit in the cafe, they will not be exposed to the health warning label because they will be in contact only with the device. And also water pipe has specific risk that is different from cigarette that comes from using the charcoal to burn the tobacco. Which produce like a lot of toxicant and carcinogen. So it has really like a special risk different than cigarettes. And the social context of water pipe also has special indication for health warning labels. So for example, sharing the water pipe in the cafe has the potential to expose to infectious disease. So to adapt the health warning label for water pipe, we thought that we should include all the elements of water pipe, including the tobacco package, the device, the charcoal, and even for the water pipe cafe alone, we think that the menu is an important element for health warning label regulation in the future. And this one is one of my favorite slides. It shows two samples of the menu. One is the current, which has the foods, the colors, the attractive woman who's smoking the water pipe, and so basically they are trying to attract customers. But while if we have some regulation on this menu for the water pipe cafe, on the other side is very blunt. It's in white and black, and it has age restriction in the top. It has text warning in the bottom, and maybe we can include in the future a pictorial health warning label, which is a picture with the text. So now I will talk about the process that we went through to develop the first set of water pipe specific health warning labels. So I will start with the gap in the current literature. There was several attempts in several countries to test health warning labels for water pipe smoking. However, mostly health warning labels that were tested were developed for cigarette, not for water pipe. And also, none were developed through a scientific or evidence-based process, and none considered the uniqueness of the water pipe smoking. So if we go back to the guidelines for developing and testing health warning labels, there are two main considerations to develop a new health warning label for a tobacco, for if we want, let's say a new tobacco methods, such as water pipe. The first consideration is the context in which the label will be embedded, which is for the water pipe. It involves the tobacco product, the device again, the charcoal, all the elements that are involved in water pipe smoking. And we also have to consider the characteristic of the target population. It should be responsive to their need and their, for example, level of education, cultural, all these factors should be considered in the process of developing the health warning labels. And in addition to the development in terms of the testing for the new labels, it's recommended that we have two formats of testing during the development of the health warning label, such as conducting focus group among the target population to give them feedback and improve the design and the content of the label. And at the end, we can do summative evaluation, or we can call it quantitative testing for the labels that can be done by experimental or lab studies. So this was our background, or our principle in developing the new labels. And based on those principles, we had a plan that included four main steps to develop the new health warning labels for the water pipe. Step 1 is to try to develop a set of health warning labels. Step 2 is to conduct a Delphi study among experts to select the top health warning labels. And then step 3 is to conduct focus group among our target population, among smoker and non-smoker in Tunisia and Lebanon, to adapt more these labels to this context or these two countries. And then step 4, we have to test the effectiveness of the health warning label in more quantitative study, including the factorial design experimental study in the two countries. So for step 1, develop a set of the health warning labels. To do this, we started. We also followed several steps. So first, we review the water pipe literature to identify priority themes for water pipe health effects. Then we develop the content, including the image and text for each label. And then we try to adapt the general design for the prototype of water type, for the prototype of the health warning label in terms of the design, like the font size, the color, borders, general appearance, and layout. So for reviewing the water pipe literature, we established a multidisciplinary expert team in water pipe research, and to review the literature. And we identify the priority themes for negative effects of water pipe smoking. And our search identified 5 major themes. The first is health risk of water pipe that is associated with a health risk for water pipe, which is mainly lung cancer, oral cancer, cardiovascular and respiratory disease, and skin disease. We have addiction, the second theme, and harm to others, mainly exposure to secondhand smoke among children and babies. And we have water pipe specific harms, such as exposure to carbon monoxide and metals and carcinogens from using the charcoal to heat the tobacco, and also have some infection disease resulted from sharing the water pipe with others. And we have another theme, which is water pipe harm compared with cigarette. And we thought that this theme would be very important to link the risk of cigarettes with water pipe, just to increase awareness of its harmful effects. So the second step was to develop the health warning label, the image, and the text. So regarding the text, what we did is we tried to develop 5 messages at least for each theme. For the image, to select the image, we searched the website of the Tobacco Health Warning Label Center, and the website is there, and it's, I think, Canadian center, but it has a lot of resources for research and for all available or currently available health warning labels in the world from different countries, from Canada, from Europe, from UK, from US. We also looked at the FDA labels in the US, and we looked at these labels actually because it's already tested and we have some evidence about its effectiveness. So it's always good to start with something that proved to be effective. And we also considered other health warning labels that were developed specifically for Waterpipe. And I will show you all the labels very soon. Main consideration for selecting the image were to be, of course, clean, easy to understand, can arouse emotion, and can lead to interest. And then the last step was, of course, to construct the health warning label. So basically to add the image to the text and decide on the general design, like color, using the word warning, and choose, like, for example, we choose the black color for the font and on yellow background. The second step after developing the set of the label is to conduct a Delphi study among international expert panel to select the top health warning label. So the Delphi study are very good methods to reach consensus on a new policy or a new health policy. And we thought that this method will help us in getting some feedback from experts around the world about what can be a potential labels for Waterpipe. To start this study, we first created a list of. We tried to identify all researchers from the publication, basically, who are expert in Waterpipe from the literature, and we created a list. Our first list included almost 80 scientists. We invited them all by email to participate in the study. We get response from 30 experts who were our participants in this study. We had 14 from the US, 11 from the Middle East. We have 3 from Europe, 1 from Canada, and 1 from Australia. And as part of this study, our participants completed 3 rounds of Delphi questions, like they completed every time a different survey in an interval time of 3 months between the survey. Basically, we had this interval between the rounds because every round depends on the results of the previous round. So, for example, we used the results and we analyzed the results of the round 1, and we used it in round 2. I will explain this very soon. So for round 1, round 1 was different from round 2 and 3 because we wanted to get really more feedback from a larger pool from scientists regarding improving the design and the content of the label. So for round 1, we included like an assessment to the effectiveness of these labels based on 5 dimensions, including attention, for example, the notice, engagement, size and color, and communication like message clarity, understandability, believability, and identification, harm perception, and intention to quit. And we also asked our experts to provide suggestions on the labels to further improve the content, as I mentioned, and the design. For round 2, so we used the suggestion from the expert and we made changes to the labels, and then we tried to stratify them in 5 groups based on each theme. So basically, we have 5 themes, and we put the labels in order in each theme based on the mean score of their evaluation in the first round. And we send a new link for participants to rank the label in each theme based on most important from 1 to from 1 round rating from the most important, the highest, to the least important, lowest score. So basically, participants were instructed to view the health warning label in each group and rank them in the order from most important to least important. And we give them some, just like a hint for their evaluation to have some standardization for the evaluation. So the question was, to aid judgment of importance, you may want to consider the effect of the health warning label in terms of attention, notice, general design, communication, clarity, understandability, believability, and effect. Example, harm perception and intention to put. For round three, so we analyzed the data from round two. Basically, we were looking at agreement between experts about the ranking, and we ranked the health warning label based on this result from most important to less important, and we send a link to participants, and we put two lists. The first one has the label order according to results from round two, shown against their own ranking. And then they were asked to re-rank or reconsider their ranking based on the results of round two. So how to select the final health warning label? So health warning labels were ranked within each team based on expert agreement, and we used the interquartile deviation, with 0 is the most agreement to 3 least agreement. Then if there was a tie, for example, like we reached the same agreement on the same health warning label, we use the median, like the smaller median or is the more important to make the judgment about the ranking. And then we chose health warning label who accomplished more than 2 agreements were selected to the final list. So now I will show you the labels that were given. So for example, in team 1, Waterpipe Health Risk, we developed 6 labels. The ones that have red border are the ones who were selected among the top and were selected for the next step of research. Basically, it's about having serious oral disease, serious lung cancer, and the effect on the skin. For team 2, we developed 5 labels, and the one that win is the one. The first one is hookah is so addictive, and you will keep smoking even after it makes you seriously ill. Harm to others, we have also 3 selected, the top 3. Hookah smoke can harm your children. Hookah smoking during pregnancy can harm your baby, and then morning hookah smoking during pregnancy can harm your baby. And for waterpipe specific harm, we have the infectious disease and the mouse disease. They get a huge agreement, and I think these 2 labels have a lot of potential among youth, especially the herpes one. And for theme 5, we have this harm compared with cigarette. We have 3 labels, and these actually were among the top. We have the first one is hookah smokers inhale about 100 times more smoke than cigarette smokers, and we have one who's like in the emergency care. The second one is about having a oral cancer, and the third one is about heart disease. And these were the top 4. Like agreement was 1 for these 4 labels. So that was the first step. The second step. And now we are now actually in step 3. We are conducting now focus group in the 2 countries among the target population. The plan is to conduct 8 focus groups in each country. We will have 4 groups of smokers and 4 groups of non-smokers. And the design of the focus group is kind of mixed method approach. So basically, we will have a survey that will be completed at the beginning of the focus group, and after conducting the survey, which will be like individual rating for the labels, we will have a discussion between the group. And for the discussion, we are providing 15 to 20 minutes PowerPoint presentation, divided into 5 theme segments, each one followed by the projection of theme corresponding to health warning labels. And each segment will end with discussion about participant reaction to these labels on the same outcomes like attention, communication, identification, improvement. We finished already 6 focus groups in Tunis and 3 in Lebanon. And hopefully we submitted an abstract with some preliminary study, but we are still waiting to complete all the focus group. Step 4 will be experimental study with factorial design. So basically, we will have 2 groups of smokers and non-smokers, and each group will be randomized to 4 conditions. Each condition is represent one of the placements. So basically, this experiment will test several hypotheses. First, we will compare the effectiveness of this label based on placement. If we put it on the device, or tobacco, or charcoal, or on all of them. It will also test the difference in the effectiveness of the label between each other. And this is the framework for our design. So basically, we are looking for, these are the main dimension or the main outcomes in terms of attention, reaction, harm perception, and intention. And for intention, we are looking for intention to quit smoking and intention to not initiate smoking among non-smokers. Also, this is a pilot study, a crossover clinical lab study that have done led by Dr. Maziak at FIU. But I just wanted to give you like it's very encouraging results. That's why I wanted to include it in my presentation. So this study basically looked at 4 outcomes: harm perception, exposure to respiratory toxicant, and smoker experience and puffing behavior. So basically, we have a smoker who came to the lab, and they did almost 30 participants. They completed 2 sessions of smoking water pipes, and we did pre and post assessment for our outcomes, including exhaled carbon monoxide that was measured before and after each smoking, puffing topography that was recorded throughout the smoking session, and the participant also completed a survey questionnaire assessing subjective smoking experience. And of course, we have 2 groups. One group is smoke the water pipe with the health warning label. The first session was to smoke the water pipe with health warning label, and the second session without health warning label. And this was randomly changed to it's within subject design. So main results compared to participants who smoke water pipe without. Sorry, there is a mistake in this slide. But however, the main results that smoking a water pipe with the health warning label resulted in higher water pipe harm perception, lower level of exposure to CO, less puffing, longer interpuff interval, and lower total puff volume, and less satisfaction and test for puffing. And this is some of the results. Like here, we have with and without the label, change in harm perception, change in the CO, and this is about like satisfaction, puffing behavior like satisfaction, and puffing liking was significantly less. Same in experience, were significant and satisfying and test were significant. So main conclusion are placing health warning label on the water pipe device is effective in reducing water pipe smokers' positive experience, puffing parameters, and exposure to harmful respiratory toxicants such as CO. Health warning labels leads also to more appreciation of water pipe harmful effects and health warning label are promising regulatory targets to address the spread of waterpipe. And thank you. I think now we can open for discussion.
Thank you, Dr. Asfar, for this interesting presentation. And now we will take questions. So to remind you, you can use your raise your hand button so that we can unmute you and ask your question directly to Dr. Taghrid, or you can use the question panel to type in your question.
No questions?
Okay, we have question from Dima Karam. Okay. Okay, no question. Huda Al-Qatirji, we can see, do you have any question? Okay, so our first question is from Dima Karam, and she is asking, can you talk a bit more about how does a public health graphic designer help in designing a message?
Sure, and I think this is related. So actually, we have an expert in health communication, Dr. Schmidt, from Memphis, from University of Memphis. But it was like a teamwork. Let me just go back to the slide. Yeah. So I will be a little bit like I will be more general about like developing a. Sorry, the question was about developing message or health warning label for public health research.
So the question was about how does it, can you talk a bit more about how does a public health graphic designer help in designing a message?
Oh yeah, like in terms of, for example, the most help we get from Dr. Schmidt was in changing the image, make it more clear, the size, using the font, the clarity, and how the picture, for example, was relevant to the text or not, and how we can improve the text. But as I said, it was a teamwork. So actually, for example, to come first, the message is very important to start with, like developing the message, and then you have to start looking at picture. And I hope like in the future, like this, we were not able to do this in our study because it will need a lot of time and I think costly, is to do your image by yourself. So this is something to consider in the future. We basically used most of the photos that were available and from other researchers or from other countries. But the final decision and the final production was from the designer, the designer part, our designer.
Okay.
He was involved in each step.
Thank you, Doctor. We have another question as well by Huda Al-Qatirji. Huda, we will unmute you so you can ask your question.
Sure.
Hello, Huda. I'm sorry, Huda, but we cannot hear you. If you can type in your question so that we can ask it to Dr. Taghrid Asfar, that would be great. Any other questions? Okay, so Huda typed in her question, and she is asking why they gave the participants first to smoke with HWL and second without.
It's a random assignment. So actually, I didn't explain very much the methods for the lab study just because of the time, and I was interested more in showing the positive or encouraging results from even a very small number of participants. So basically, this is a random design where each participant will attend 2 smoking sessions for Waterpipe. So the first and second will be different by subject. So for example, one subject will have the first session with health warning label, the other one without. So it's within subject design. So we will see the effect on the 2 effects, with and without health warning label, on the same subject. I hope this is helpful.
Okay, and she's also asking, can it be better to ask them first smoke without, as they do usually, and then with label, so we can have real effect of the HWL?
It's just it's design issue. It's so the random assignment for with or without the label will protect from the carryover. So basically, when I do this random assignment, the same subject with the same subject has the 2 session will protect me from having the carryover effect. So for example, if a subject smoked, the first session was to smoke the Waterpipe with the health warning label, and they come to the next session, the second session, and they smoke it without it, but they are already exposed to the health warning label in their first session. But when I do it randomly, so at the end I will have like an equal, I will control for this factor.
Okay, thank you, doctor. So we have a question from Ramamon Haja. He raised, so I'll try to unmute you. Maybe you can ask your question directly. Hello? Hello?
Hello, I am Haja for Madagascar.
Okay, so
Hello?
Dr. we can hear you, and you can ask your question.
I can hear you. So I have a question. It's possible to have this presentation for WhatsApp or email?
Sorry, I didn't hear very well. Can you repeat that question?
Hello?
Yes, I can hear you.
Yes. So I have a question. If it is possible to have this presentation to WhatsApp or to mail for us?
I'm having difficulty.
I'm sorry, we cannot hear you. Can you type in your question so we can ask it to Taghrid? That would be much better, please. In the meantime, Dr. Taghrid, would you like to say or have any comments as we wait for the question, final comments about the project?
We are very excited to share our results with with other institutions in the Middle East, and we're happy to even work with somebody who's interested in testing these labels in their own country or their own institution. We are looking forward to analyze the results of the focus group, which will give us very good insight on further developing and adapting the labels to each country. And I think that's it. We hope that this will have some implication and we will have this regulation in place very soon in the Middle East, which suffer a lot from waterpipe smoking.
Okay, thank you. Interesting. Any other questions? Okay, so is there a way maybe to contact you for questions or emails, further emails?
Sure, yeah, sure. I can provide my email to you, I think, and you can distribute it, or would you like me to give it now?
Yes, maybe we can give it after the webinar.
Okay, sure. Okay. Anyone has any question, I'm happy to answer.
Great. Okay. Thank you. Do you have questions? Okay.
Okay, well, thank you. Thank you very much, Nadia, again, for your help in moderating the session. And thank you for inviting me again for this webinar. And I wish you all the good luck with your efforts. It makes a huge difference, I believe. Thank you very much.
Thank you, Doctor. And thank you, everyone, for attending the webinar today.